Thanks. This is a great crowd to stay till the end, almost the end of the presentation. We've got some wonderful presentations about caring for the ACHD patient this afternoon. My name is Paula Miller. I'm the Senior Education Manager at the Adult Congenital Heart Association. But before we hear from the professionals, because the patient voice is really a huge part of caring for the ACHD patient, so I wanted to just take a few minutes, maybe 10, just to tell you a little bit. So most of you probably know about the Adult Congenital Heart Association, but I wanted to take you through just a little bit of a tour because today is a very special day in the history of ACHA. It is our actual 20th anniversary, October 27th, 1998. We first signed the papers to become a nonprofit. So it's been a very historical couple of weeks with us with having celebrations, and it's wonderful to be here and represent ACHA on this conference once again. And I thank Huie and the staff and faculty at Houston Methodist for having us again, and particularly for having me. So just to give you a little bit, if you don't know, and hopefully I'll get this right. There we go. This is our mission. This wasn't our original mission, but our original mission is pretty much the same. Our goal is to extend and improve, or improve and extend the lives of the millions born with heart defects through education, advocacy, and the promotion of research. As I said, that's pretty much where we started. That's where we are right now today. Who are we? Other than what I just said, we are actually the first and only freestanding nonprofit who deals with the issues and concerns of adults with CHD. We are a trusted partner of those of you who are patients and living with CHD, and we bring together not only patients and family members, but the healthcare community as well, and the medical professionals to create this community and a support network. We know that CHD, we've come a long way in knowing this, and CHD is a lifelong disease. We have to make sure that each of us is taken care of from birth all the way till the end of our lives. This has been, for those of us who are a little bit older, a hard lesson to go through, and for those of you who are younger and for children, it's going to be much easier to get to this point. But we want to make sure that we help as an organization to facilitate and educate this lifelong care continuum from childhood to adulthood, and to raise awareness of the need for this in many, many ways. So we also bring together the medical community to educate the medical community as much as we can. We have an amazing medical advisory board who is with us step by step to make sure we're giving the right information. We have a lot of educational material we put out, including webinars. I'll talk about those briefly in a minute. Printed materials, some of which have been at our table. But because there's limited research to date on this population, we've served as a liaison to work with connecting all the relevant clinical stakeholders. We work with many of these medical professionals in here on different aspects of research to try to bring this together, and I have a really exciting announcement to make in just a minute. Okay, so I just want to take you really briefly to the ACHA website, because a lot of people don't know this, and they find it very difficult to, for some reason, difficult to navigate. So I thought we would just to show you, this is our homepage, and there's a lot of great things on here. If you go up here, you can pull down any of these, and I'm not going to pull them all down. I'm going to show you some of our programs in just a minute, but that's just a little bit about our webpage. So, okay. So we have a lot of programs. Some of you may have seen this slide before, and I apologize if you have, but I'm just going to throw them up here really quickly, and I'm just going to show you on the website a little bit about some of these programs, because I don't have enough time to go over all of them. So we have webinars, which I just mentioned. We have webinars all the way back to 2009. If you go down here, you can see what's coming up. We have 2 coming up in November, 1 in December, and then all our past webinars are archived here. These are here forever and ever, and you can go all the way back to 2009 and see webinars from ACHA. And many of the people sitting in this room have provided webinars for us. So they're great educational resources. Most are still timely and still up to date. Others we repeat on different time frames to get there. The next thing, our ambassador program. I'm going to go to our clinic directory program, because this is also, so we have In addition to having an accreditation program, which I will talk about in a second, this is our clinic directory, and we've done this in association with the International Society of Adult Congenital Cardiology. And we have, you can see, this is where a map that shows you about where in this country that there are self-identified adult congenital heart programs. Houston has 3 on this map. Some states, as you can see, have none. Again, these are self-reported. There may be people out there that are practicing adult congenital cardiology, but they haven't let us know they're there. But we have over 100 of these on here, and you can click, let's just, since we're at Houston Methodist, let's just go down here to Texas, and we'll go ahead and click on, this should be it, click on this program here. So you can just sort of see what we have. Let me make sure I get the right one here. There we go. So you can see here it shows you the program, what year they were started. You can click on it, you can search it, you can find out how many patient visits they have a year, how many sessions they see patients, where they're seen at, who your outstanding medical director is. You can also see, this one needs to be updated because I know Bernice is not here yet, but we haven't got this updated yet. We're working on it for last year, but anyway, it tells you the description of the program and on and on and on. So this is for every single program. These are survey driven. The docs and the practice people send these in every year based on the survey we send them, and we try to keep it up to date because we want you to have the best information as a patient so you can be an active part of your care. We have an ambassador program. I'm not going to click on that in respect for the time, but we have over almost 70 heart-to-heart ambassadors, some of whom are in this room. I think we have 3 that I know of that are here today. And they provide, yes, thank you, Tony. They're in the back of the room, at least 2 of them, and I don't know if Lindsay's still here or not, but they're a huge asset. So for those of you who are professionals, if you have any patients who are going through challenging times and need to talk to somebody via email or telephone, we have these wonderful, very well-trained ambassadors who are either patients or family members, or sometimes just friends of patients or family members who can help out. And the last thing I want to show you on this part are the regional conferences, which is a fairly new initiative. We have had 3 this year. We have our last one for this year next week, and it's in Northern California. We're working with 3 programs there, and we'll begin to start our planning for next year as soon as this one's over. So we have 4 lined up for next year, and they will be in Houston, Atlanta, Denver, and New York City. So we'll be back here with the ACHA regional program, and we're very excited about that. Why do we advocate? It's very important. So unless you care about or someone like you cares a whole lot, nothing is going to get better. It's just really not, and that's from Dr. Seuss. And I said this last year. I know I stood here and said this last year. It's so important for everybody to be a part of advocacy. We need you to get out the Congenital Heart Futures Reauthorization Act. If you didn't come to my table, it is up for being approved, and we're waiting for the Senate to vote on it. I mean, we need your voice. We need you to go talk to your senators and tell them to vote for this. It passed the Health Committee bipartisanly. We don't expect to have any problem, but you never know. So we need your voice. We need your voice year-round. Please come to DC with us March 4th and 5th, which will be the next time that we're doing legislative advocacy on the national level. And more will be coming out about that, so watch your email. And if you aren't a member and don't get our emails, come to out there, and Kristen will be happy to take your name and email address, which, by the way, Kristen, I don't know if she's in here or she's out at the desk, but Kristen Edwards is our local Houston Community Development Coordinator. If you haven't met her, please meet her. She is here for those of you who are local to Houston, doing some wonderful things in this community. She'll be having resource groups, and she'll be having meet and greets, and she'll be putting together a group to go meet with local representatives and senators in the next couple of weeks. So over here, the accreditation program. And something you all professionals may not know about is our Actelian Fellowship Award. We award 2 fellowship awards every year to programs who are trying to fund fellowships for adult congenital cardiology. So if you're interested in that, unfortunately the deadline just passed for this next one, but if you're interested in next year, keep a watch on this. Join us, you'll get some emails about it. It'll pay for 1 year out of a 2-year fellowship program. So I don't know if anybody in here has been able to take advantage of this before, but it's a great opportunity to help to increase the numbers of ACHD providers in our country to take care of those of us who are patients. So just wanted to tell you about that because it's one of the things that people don't know too much about. And then accreditation, which will be the last thing I'm going to mention here on this, is the accreditation program, which we're very proud about. It's really relatively new. We have 21 programs that are accredited and many more who are going for accreditation. That's just a list of programs that so far have been accredited. And again, you can find this and listen to Sue Fernandez from Stanford and why this is important on our website. We didn't do this entirely alone. We did get support and endorsement from these organizations who are very important stakeholders in the congenital heart community. So just know that, we are out there. People will say to me, well, you've taken the focus off the patient because you're doing things like accreditation, but the fact is that is the focus on the patient. We've not taken the focus off the patient. We're doing the same things we've done with our ambassadors and our support, but this is for you, the patient, to make sure you get the optimal care. It's not the, right, yeah, yes. Do you have a question, Webb? Oh, okay. Stretching, okay. But anyway, it's a wonderful program, and it's been years in the making, and it's just going to grow and get better. And we hope that, one of the things we're asking for in Congress when we go back in next year will be, to make sure that that healthcare insurers make sure that they will allow patients who have CHD, adult congenital heart disease, to go to these providers, not just accredited providers, but ACHD providers, and that they are aware of the difference between general cardiologist and ACHD cardiologist, so there's not the constant fight, and I don't have to get on the phone with somebody and be so upset because they can't get out of that general cardiologist care and even get seen by an ACHD cardiologist, which is heartbreaking. We hope that's just one of the many things we're going to be talking about. And this is what I really want to announce. We're so excited about this. We've been trying to really do this. We've always had promotion of research in our mission statement, and we've promoted and supported a lot of research, but we are now going to be funding research. This is the best news that I could present to you today. The call for abstracts and proposals will be, actually proposals, not abstracts, will be next month, in November. So if you're looking to do research and you would like to get some funding from ACHA, be sure to watch your email, watch our website as this comes out. These proposals and applications, rather, will be due, on the 16th of January to be funded next year. There will be 2 presented to ACHD faculty, and there will be 1 presented to ACHD fellows. So it's it's a beginning. We could not be more excited. There's a lot involved in this, as those of you who do research every day, you all know this. It couldn't be coming at a better time. This is going to take us as an organization and this community to a whole new level. And we will be focusing on, trying to achieve our goals at ACHA of achieving the best possible outcomes for people with congenital heart disease. And if you can see the little cartoon, what is it? And you look at the picture, you said to do an abstract. Well, that's about research, so it was the cutest cartoon I could find about research. But anyway, we're very excited. Any questions you have on this, contact Danielle Heil. I can give you her email address, but she's the person in charge of this. And our future is bright, but it does take a village. This is my slide from last year. We need every one of your help. And with that, I'm done. So I'm going to let you hear from the medical professionals who are here to talk to you about the care of the adult congenital heart patient. And I don't know where to go next with this thing. So the next presenter can do it. Thanks.